hello, everyone. It's now officially 7 o'clock and we can get started. Thank you for joining us tonight. My name is Sarah from the Pennsylvania Dental Association. And then we also have Dr. Tucker from the Pennsylvania Dental Association Board of Trustees. We have a great presentation planned for everyone, and we will get started in just a minute. Just a few housekeeping things first. As you can see on the right side of the screen, we do have a schedule for the event tonight. So Dr. Tucker will be presenting from 7 to 8, and then afterwards we will have a Q&A.
So thank you so much for joining us tonight to discuss dental guilt. I just want to introduce myself very quickly. My name is Nipa Thakkar. I'm a general dentist in Westchester, Pennsylvania. I've been out of school for, 11 years. And I'm just really excited to talk to you about this concept, and I'll just give you a little bit of background on like sort of the birth of this lecture. So maybe 5 or 6 years ago, I began talking about dental guilt, and it was really after experiencing firsthand, what it feels like to constantly feel like you're falling short, wanting to give your patients perfection, wanting to do the absolute best for them, and kind of going home all the time thinking, why can't I reconcile the discrepancy between, what my patients are expecting and what I'm able to deliver? And then recognizing that maybe some of that's internal, and maybe some of that has to do with how we in this profession hold our standards and what that does for us as healthcare providers. So that's where that comes from. I'm a general dentist. I practice in a small practice kind of on my own with my team. And I'm also on the board of trustees for the PDA currently for Philadelphia. And I'm not an expert, I'm not a psychologist, I've just really taken a lot of time to learn about the concept and to try to come to terms with this feeling and how to, kind of fix it for myself. And so from that was born this talk and this concept. And I've been asked to lecture several times to students, and the feedback has been very positive in terms of this has been super helpful for me as a student or as a new dentist or as a resident or as, a more seasoned dentist. And I just can't seem to figure this out or rationalize it. And I'm so glad that, it has a name. So I just wanted to give you guys some background on that. So, what is guilt, right? So we start with, dental guilt as a concept, but the concept of guilt overall, guilt is that feeling of remorse or responsibility for something wrong, whether it's real or perceived. So whether something actually went wrong or whether you perceived it as not having gone to your standard, all of that can consume you with guilt. And so, we've heard that concept or that term to err is human. And it's important to note that there was actually a large healthcare study done in 1999 by the Institute of Medicine called "To Err is Human: Building a Safer Healthcare System." And really what that report did, what that study did, was it broke the silence surrounding medical errors and the consequences of those errors. But it, for the first time, didn't point fingers at healthcare professionals who made honest mistakes. So of this article or of this study was born, morbidity and mortality studies in healthcare settings. Really we were able to look at reducing medical errors and improving patient safety and designing safer healthcare systems without looking at doctors who committed medical errors as individuals who were reckless or incompetent, without looking at them as though they had done some irreparable damage intentionally. So it was really the first time that we were able to look more compassionately at our doctors and to see them as human. Also the first time, that a doctor who made a mistake wasn't considered a bad person, but rather maybe a good person working within a bad system or setting that just needed to be made better for them. And I think that's important in dentistry because in many practice settings, oftentimes our healthcare decisions for our patients are not our own. There are other influences, other factors, treatment plans that we didn't make, or production numbers that we need to meet that affect the way we feel about the care that we provide. I think it's really important to take the time to recognize what mental health load that has on you as a healthcare provider, and take the time to reconcile how you can correct that for yourself, how you can create a better system within which to practice dentistry. So, let's talk a little bit about guilt versus shame and how our culture plays a role in how we feel. So this, I think, is very interesting. It's not dental, it's just about life. Who you are, the lens through which you experience the world has a lot to do with the way that you were raised. And these are not to be prescribed as stereotypes, just general kind of understandings about different cultures. There are cultures in this world that are prescribed generally as guilt-based cultures or shame-based cultures. Some really commonly known guilt-based cultures are Judaism and Christianity. So in those cultures, there are these concepts of a doer versus a deed, or a sinner versus a sin. So there's a distinction between the two. There are concepts such as, apologies and absolving oneself, atonement, repentance, whereby, an act may be wrong, but that doesn't mean the character is flawed, that there is an opportunity to be better, to do better, to grow, to learn, to have moved on. There are other cultures that are shame-based cultures. Many of the cultures prevalent in Asia, also ancient Greece, whereby mistakes are generally looked at as character flaws. There isn't so much the concept of absolving oneself from a shameful act. Rather, the hope is that we can forget. So time is what ends up healing within shame-based cultures. Many times individuals who are raised within the constructs of a shame-based culture will do absolutely anything to avoid acknowledging that a mistake has been made, because it would bring shame to their family or their professional unit, or to whatever area of influence they find to be significant. So, and I don't say that again to put people in buckets, but only to look at the way that we view mistakes that we make based on the lenses through which we see the world. So I just think that's a very fascinating concept. Of course, I won't go into it much more than that, but I think it's very interesting to look at oneself and see why we feel the way we feel about the things that happen as a result of our actions. So let's talk about this a little bit. This is a picture. Some of you may remember this, some may not. It's pretty old at this point. It's from 2015. It's a picture that went viral. It's a physician who had a patient death of a 19-year-old girl in Southern California, and an EMT snapped this photo. And you can see the physician here just kind of bent over. Tragedy had struck and he was crying, and he was interviewed after, and he said, we were never formally trained to deal with loss. He didn't know how to manage this, And so I just think it's important to recognize, despite your best intentions, sometimes your outcomes are not the way you want them to be. And it's important to recognize this happens all over. It's fairly ubiquitous in healthcare. And one of the ways that I, deal, for example, with feelings like this, right? Obviously, in dentistry, I can't say that what I do every day is life or death, but it's extremely important to me for a lot of reasons. Is I try to tell myself, you're not faking it till you make it. I don't need to be stoic and poised all the time. I need to face it till I make it. I need to talk honestly and genuinely and with authenticity to my patients, to my team, about the way that I feel, about the best that I'm trying to do, and about where I'm afraid or fearful that I may fall short. And I think that that's the best that we can do for ourselves. But this image is just really reflective to me to show that, we're human, that these things happen. So let's talk about a concept called the second victim. So in the year 2000, in the BMJ, which is the largest medical journal, Dr. Albert Yu of Johns Hopkins University wrote an article called Medical Error, the Second Victim. The doctor who makes the mistake needs help too. And it was the first time ever that this term was coined, the second victim. Before this, there really wasn't a place in modern medicine for errors to be recognized. Society trusts doctors to be perfect, but we're people. Before this, hospitals often ferreted out the blame to individuals for errors and treated all of those errors as anomalies, quickly promising that those things would never happen again. But we know, like we know in dentistry, mistakes happen all the time. Our best is often not perfect. And so it's important to recognize that mistakes can be made no matter how good your intentions are. So second victims are the healthcare providers who are involved in the unanticipated adverse patient events, in medical errors or in patient-related injuries, and they become victimized, and they're victims in the sense that they're traumatized by the events that happen to them. They feel personally responsible. Many of them feel like they've failed their patients. Many of them second guess their clinical skills and their knowledge base going forward. I'm sure this resonates with a lot of us. You wonder, oh my God, how did I get here? I can't believe I was trusted to do this, for example, or can't believe I let this patient down so badly. It's just really traumatizing for us. And so I think it's really important to recognize what a second victim is and the fact that you are not a bad person because, for example, you might feel like a second victim during an adverse event. One of the best ways that I can show you how common this is for me to show you and share with you my support group and my friends and my peers and my family and the people that I know I can call and talk to if I've made a mistake. So what I've done is I've collected a series of little 1-minute snippets of incidences of friends, of people that I know and care about. And they're opening up their hearts to you and they're sharing with you their biggest dental guilt incidents in their practices. So just take a few minutes and just go over those with you. So just make sure your volumes are up.
So when I was working at a community health center, I had a patient come in who had a periapical lesion on one of his lower anteriors. The tooth had a large buildup on it and was somewhat periodontally involved, so didn't have a great long-term prognosis. The patient was on Medicaid, and even though Medicaid covers root canals in our state, for a tooth like that, I would have ideally had the patient see an endodontist, but I don't know any endodontists in the area who take Medicaid. So I discussed with the patient that we could try to save the tooth with a root canal. Of course, I started the root canal and perfed the first tooth that I've ever perforated about mid-root, and the tooth ended up needing to be extracted. The tooth really had a poor prognosis to begin with, and I felt like I was trying to do my best job possible for it.
Sorry, that one cut out. We'll keep going here.
Hey everybody, my name is Ray Jarvis. I'm a general dentist down here in Louisiana. One of the first experiences that I had with dental guilt was about 2 weeks after graduating and starting my practice. And I had a patient come in who was a longtime patient of my partner's, a very nice gentleman. They had a tooth that was kind of bothering him for a little while and was recently getting worse. And we wanted to start a root canal that day. It was a tooth, a lower molar. It was very difficult to get anesthetized. And from what I remember, even more difficult to clean and shape the canals. But we got him through it and temporarily closed him up that day. And I got a call from him that night. He was in severe pain, even worse than before when we started the procedure. And he was truly in tears from all of the pain that he was experiencing. I was able to call him in some pain medication back in those days, which we can't do now as much. But we were able to kind of get it under control some degree and then get him back the next day and solve the issues that he was having. But it certainly took a toll for that first experience that I had, having those feelings where the procedure that I put the patient through caused this person more pain when we certainly try to take care of people and get someone out of pain. But it's certainly something that we all deal with and eventually figure out how to somewhat handle. But that's just part of treating people, and everybody reacts differently to procedures. And you can usually, over time, get the patient feeling better.
So I'll share with you my story of dental guilt. And let me preface this by saying that this is not the only time I felt this way in my career. Even if you feel it once, odds are you'll probably feel it again down the line at some point. And I think it's totally normal and very situational dependent. You know, as dentists, we are by nature perfectionists. We place such a strong identity on the quality of our work and the career that we've chosen that it's inevitable sometimes to carry these feelings around with us for some time after something doesn't go quite according to plan. So my story is that a young woman came into my office. I met her for the first time, and she was competing in a beauty pageant, like a Miss USA, Miss America, Miss Universe type thing. And so she said to me, "Can you fix my smile? And the beauty pageant's in 2 weeks." And I said, "Oh, gee, you know, that's a really short time frame. I don't know if we'll be able to help you out by your deadline." Well, it turned out that all she needed was a veneer on tooth number 7. And so we made it work. We jumped through hoops, we rushed the lab order. So fast forward to 2 weeks later, the day before her beauty pageant, she's in my chair again, and we're trying in the veneer. And it looks just beautiful. It's so beautiful that she's moved to tears. And then I get ready to do the final cementation, and I dropped it on the floor and it cracked in half. And there is just no coming back from that. She was, again, moved to tears, and she was just devastated. You know, she's someone who places a very high importance on aesthetics, and I let her down. You know, to be the reason for someone's disappointment is a tough pill to swallow, and you can bet that I was keeping myself for a really long time after that. You know, we made the best of a bad situation. I ended up doing a composite on the facial number 7, and it didn't look anywhere near as beautiful as the porcelain veneer would have, but she did end up winning Miss Congeniality or Miss Photogenic or something like that. But I just, you know, am here to tell you that, you know, accidents happen, things happen, but it does get better with time.
I think that's really important. And I have a few more, because I do think, again, it's important to hear from not just me. It's important to recognize, you know, you could be well seasoned in dentistry, extremely successful in your field. The doctors that you just had a chance to have a minute with, and the ones that I'm going to have you hear next, they are incredible at what they do, incredible clinicians, and yet encounter dental guilt pretty consistently. And I think that's important, at least for me, it was to realize this isn't a one-off, you know, this is a part of what we do. We take care of people.
I'm Dr. Amrita Patel, and I want to tell you about a moment of dental guilt that I had early in practice when I started. It was my first 6-unit anterior bridge case, and I was really excited to help a patient that had been waiting a long time for teeth. I did what I thought were beautiful preps, gave her a great looking and great fitting temporary. And of course, I get home and see a message on the emergency line that the temporary has broken and it looks like one of her teeth have too. I go racing back to the office. She comes in after hours, and I look, and one of the abutment teeth has snapped. And a case that should have been really straightforward became really complicated really quickly. I beat myself up for a long time over that because I was just trying to do the best I could for this patient. And what I realized is that we call it the practice of dentistry for a reason. We practice on mannequins, we practice on a lot of plastic teeth, we practice on each other, we practice in CE, and the best thing that I could do for myself to find some peace in all of this was to continually be teachable and learn and grow and keep evolving, and to not beat myself up so much the next time something happened.
A moment I recently had of dental guilt was when I was working with my resident. We had a patient come in and we did a spec pulpotomy, which is a type of pulpotomy that you'll do after a child has had dental trauma and the pulp has been exposed. And, you know, it's really great to see the resident do this. This is their first time doing it, and to be able to work through it with them. And the patient was asymptomatic following the procedure, and after a couple follow-ups, still asymptomatic and very happy. And we were feeling good about moving towards the final buildup. And of course, we take an x-ray and I see this huge periapical lesion. And now we're talking about endo and putting a hold on the actual treatment. And I felt sick to my stomach because I felt like I had failed, not just my patient, but I had failed my resident. I had failed as an educator, and it just ate at me. And I just went home that day questioning every single thing.
I remember when I was just starting out as a new endodontist and I was in a new area practicing, I had seen a patient referred to me and I had access to premolar, very difficult access calcified canals, and I perforated on the mesial wall. But because there was a crown on the tooth, I did a repair and I didn't think much about it. And I sent it back, assuming that they would fill the crown access and all would be good. I neglected to say anything to either the patient or the referring doctor. This was probably out of my own embarrassment, right? And I get a call from the referring doctor a few weeks later. He had decided it was time to replace the crown. He had seen the repair and was concerned. And so he called me up and proceeded to ream me out justifiably because I did not tell him or the patient what was going on. He told me how inconsiderate and incompetent that was. And he was right on 100% of these comments. He sent the patient to a periodontist, and then the periodontist sent me a bill for $1,000 for crown lengthening. This is back in 1989. Anyway, as it turns out, the patient was fine. And over the next few months, I did my best to repair the reputation with both the referring doctor and with the periodontist. And they both became probably my top 1 and 2 referring doctors for the next 20 years until each of those gentlemen retired. I'm not going to say that it's appropriate to not disclose stuff. And I learned very early on, no matter how embarrassed you are, you need to tell people what's happening, good, the bad, and whatever. So great lesson learned early on, never made that mistake again. But it ended up working well for everybody involved.
Just a couple more.
Hi, I'm Nancy Rosenthal. I'm currently president of the Pennsylvania Dental Association. Dentistry has cost me guilt when I come to the office expecting to see patients and expecting patients to show up, and that staff member, whether it's an associate or a hygienist, doesn't come in, doesn't cancel until the last minute. And I've asked people to take time out of their schedule. I realize it is not me that's doing it, but I always feel very guilty for asking people to be loyal to myself and my practice and then disappointing them when the staff member does not come in.
Hey everybody, my name is Seth Walters. I'm a dentist in Easton, Pennsylvania, and I wanted to share a situation that I was involved with in practice. I see a lot of emergency patients. I do a lot of emergency treatment. It's just what I like to do. Root canals, extractions, that sort of thing. And I had a young lady who was in a tough situation financially. So we want to help her out. She had a lot of swelling. So we said, hey, we'll do this extraction for you for free. We'll make things, a little easier for you. So I get in there, section the tooth, pretty standard in practice where I am. And after I got all the roots out, I checked, and the palatal root area had a sinus perforation. So it was borderline whether, this was going to be something that we should refer right away or not, or whether it's something that I could plug in the office. So place the collagen plug and, suture things up, sent her home, followed up in about a week and a half, 2 weeks. When she came back in, it looked pretty bad. And I felt terrible about it because I essentially just turned this young lady's tough situation into a tougher situation. Eventually, we ended up referring her to an old surgeon, and they had helped a lot to get her back on the right track. But something that I'll always have to live with, and I think about it a lot, especially if I'm extracting an upper molar.
So I hope that was helpful in a lot of ways. Again, I think it's really great to get perspective. I call on those individuals from time to time as friends, and as part of my support. So, how do you handle a mistake? I think it's really important to take some time, have a moment of introspection about how you manage dental guilt. How do you handle when outcomes don't meet expectations? So in life, how do you do that? The feelings associated with making a mistake, shame, guilt, fear, panic, humiliation, embarrassment. How do you reconcile those feelings in life? Typically for me, it's been very helpful to share with patients. Again, the least I can do is the best I can do. I will do my absolute best for you. Sometimes outcomes do fall short of expectations, but please know I'm in your corner, and the goals will always be the same, and that's to provide you with optimal oral health, right? In dentistry, that's important. In life and in dentistry, for me, intentionality has meant everything, and I've become very clear about what my intentions are. And I say that to my team to absolve them of dental guilt, because sometimes things break in the office, or they don't work the way they're supposed to, or I forgot I was supposed to come in half an hour early and I left you without an assistant, Dr. Tucker, and I'm really, really sorry. That's okay. Your intentions were good. It was an honest mistake. Your intentions were not foul in any way. You didn't mean to do that thing or leave that thing behind, or neglect that thing. The intentions were good. If your intentions are good, my firm belief, is that you can reconcile any mistake that's been made, and you can absolve yourself of guilt, if you recognize what your intentions are. And I think that's extremely important in dentistry, in life, absolutely. For your own mental health, and for recognizing, in dentistry, perfect is a very dangerous word. It's a very scary word. And oftentimes it sets us up for failure. Another word I really don't like in dentistry is failure, but it's important for us to recognize when you set yourself up for dentistry to be perfect, you also set yourself up for failures to occur. It's really hard to meet those goals. So instead, if you just promise to do your best, if you know your intentions are good, then you can relieve yourself of a lot of the trauma of falling short. So what exacerbates guilt? I think it's really important to recognize, that the way that we feel about the dentistry that we do has a lot to do with public attitude, and the way that patients walk in expecting a certain type of care. In the past, and many of us are very well aware of the fact that dentistry has had a very biased public attitude and a very biased public opinion. Oftentimes, dentists are thought to be greedy or rich or swindlers, or there's all kinds of sort of feelings with respect to dentistry and dentists in general. It's very important to remove yourself from those stereotypes, and to recognize the ways in which you are different. And to highlight those differences publicly, and to share with patients what your intentions are and how you don't fit that mold, and to help break those stereotypes. And that will help really right at the beginning, right at the onset, to set yourself up for success with respect to not feeling and not having extreme guilt. Fear of litigation is another thing that really will exacerbate guilt. All of us are from time to time afraid that we might have made a mistake, that could cost us, right? We've spent a lot of money and a lot of time. We've invested in so many ways into this career, and it's scary to think that that can be taken away because of a mistake. So to assuage yourself of that, the fear of litigation, and that really exacerbated guilt as a result of that fear, is to be open and forthcoming, and to communicate with patients about, again, what expectations are. Also, to have a really good relationship with your malpractice provider. It's important to recognize that those are the people that are in your corner. If there is something that's happened, that's occurred, that makes you wonder, that gives you pause, or for fear of litigation, ring them, give them a call, TDIC, EDIC, whoever your malpractice carrier is, just pick up the phone and say, hey, this is what's occurred today, and this is the way it's made me feel, and I have this fear, and I'd like to know about it, because chances are they've had that situation happen. It's come across their desk. They can walk you through it. They can help, take you out down from the ledge there. And then a lack of support exacerbates guilt, not having the right people, not having the right support system, around you, and not feeling like you can commiserate with others is really stressful. So, often it's important to check the people around you, and to make sure that you can be your authentic self with those individuals, that you can share your victories, for sure, that's important, but also that you can share your shortcomings, that you can be very clear and honest about where you wish you could do better, or how you could have handled that differently. And you can get constructive criticism and support, most of all. So let's talk a little bit about the 6 stages of recovery trajectory. So this is a really interesting concept, It comes from a 2019 study called Support for Clinicians Involved in Errors and Adverse Events. And that was done by the Agency for Healthcare Research and Quality from the U.S. Department of Health and Human Services. And they identified that when recovering from an adverse medical event, so again, being a second victim to, or being the healthcare provider involved with something that would cause guilt, it's important to recognize there are 6 stages, and really the way that you respond to all 6 will impact how you'll be able to move forward, and hopefully at the bottom you'll see thrive. So we'll talk about that a little bit. So the first is the chaos and accident response. So the actual event, right? So something's gone wrong, you perforated a sinus, for example, or you've got yourself into an extraction that you just can't finish, or you thought you could do that endo, but you can't find MB2 and you're in the weeds there. So it's really important to recognize when you need others to take over. It's really important to be able to, with a clear conscience, sit a patient up and say, I don't think these are the best hands to finish this procedure. And so I'm going to refer you to who I would go to see if I were in your shoes, or who I would send my mom to if she were in your shoes, because I think that's what's best for you. And that's the first thing that you can do for yourself. And the second stage involves intrusive reflection. Intrusive reflection is that haunting reenactment, taking that time to really think about, oh man, I did it wrong. I'm not right for this profession, this career. I can't believe I did this. So really trying to obviously work through that stage, but also let that stage rest, right? Because it's important not to always feel like something you've done wrong makes you somebody who is wrong. There's a difference. So it's very important to realize that there's a difference there. Restoring personal integrity is important. It's seeking support from trusted people. It's something that in dentistry and in medicine, and less so thankfully now than in the past, it was almost a veil of, I have no idea what you're talking about. I've never made that mistake. You're on your own, kid. And it's really nice to see that now we're more collegial with one another, that we can talk to one another about, I didn't know I'd handled this incorrectly. And to kind of help with that self-doubt. So again, take that time to restore your personal integrity, find the people that can help lift you up, that can help put things in perspective, that can help you recognize, a bad tooth or a failed, filling is not a failed doctor. And then the next stage is to prepare for enduring inquisition. And that could be a lot of things, depending on the severity of the incident that's causing the guilt. It could involve litigation. It can involve your license being put into question. It can involve just a really difficult conversation with the patient, right? Or your boss, for example, if you're an associate, or your malpractice insurance. So to prepare yourself mentally for that inquisition, wondering about what's going to happen to my job, what's going to happen to my license, for example, just preparing for that, and to recognize that, you will be able to handle it and put it in perspective with respect to all the good things that you've done, in your career versus this thing that you've done that's put you up for inquisition. And then finding a safe place. Oftentimes healthcare providers, especially in this study, had mentioned that there's a lot of ambiguity about who to approach and what can be discussed because of privacy issues, litigation concerns. It's difficult to know where that safe place is. So find a safe place for yourself, your friends, a study club, etc., your local dental society. Just find a group of people that you feel comfortable being honest with. You don't have to disclose patient names. You don't have to be more specific than you feel comfortable, but definitely take the time to find some emotional first aid. And then the 6th stage of recovering from, an adverse effect as a second victim is moving on. So from least obviously advisable to most advisable, the first would be least advisable would be to bail. So there are, unfortunately, in our profession, healthcare providers who bail, who unfortunately, leave dentistry, leave the profession, leave clinical practice, quit their jobs, unfortunately commit suicide, all kinds of things because of guilt that they feel, because of procedures that have been done or care they've provided or care they've neglected to provide. So it's really important to recognize that that is unfortunately something that does happen in our profession. Surviving is, doing okay, maybe not thinking about it, having a hard time forgiving yourself. You heard in the 1 minutes from a couple of people, I think about it all the time. You know, it stays with me every time I'm doing this. It's almost like a PTSD, right? So surviving through it, that's one way of managing, and it's not wrong. And none of these things are wrong. They're just the way you feel, but it's definitely one thing to do. And then thriving would be the most advisable, right? Is making something good come of the event. So fixing up those systems, cleaning up the way you do things, cleaning up inefficiencies so that, you know, you can make sure that you've set yourself up for the best type of success so that those things that have made you feel guilty don't continue to do so going forward. How do you ask for help? Who do you talk to? And what are the resources that are available? What can you do to help yourself, right? So obviously talking to your colleagues, like I've said many, many times, it's just so important. There was a wonderful study done by Dr. Wolf in 2009 about second victims as very akin to people who have PTSD. So over 3,000 doctors were studied, and it was validated that moderate to severe levels of emotional distress were noted as years of practice increase. So really having like trauma, and a lot of you might be able to resonate with this thought, you know, you're kind of hovering around the front desk, patient calls, you hear the receiving end of the conversation, front desk says, oh, what tooth? Oh, it broke. Oh, I'm so sorry to hear that. Right away, you're thinking, what patient? Who? When did I do? I don't understand what happened. And you're starting to panic right away. You're starting to feel that impending doom, that dread of, did I do something and didn't work out? And how did I do it wrong? And what could I have done better? So really taking the time to recognize that those feelings are real, and that many of us share them. We all know what that feels like. And just because we feel it doesn't mean it's our fault. So again, talking to colleagues, super important, and recognizing and commiserating with one another on those feelings and giving them a name. And then I'm sorry laws are really important tools to recognize that we have. They've been enacted in over 30 states so far, and they protect clinicians from legal liability and malpractice suits for expressing sympathy after a medical accident. So really, if you as a doctor sit down with a patient and say, you know what, I apologize. I am sorry that this did not work out the way that you and I both intended for it to work, that does not mean that you are claiming liability for the outcome of that procedure or for that moment. So it's been proven that laws that protect candid communication significantly decrease the number of malpractice lawsuits from those events. Many patients just sue because they feel confused. You know, they don't understand. You feel guilty, so you clam in, and patients feel like that doctors aren't taking responsibility. And that emotional distance, that refusal to accept and communicate, often causes anger and resentment and guilt and all of these bad feelings to propagate and to become real and scary. And then consent, you know, one of the things that I do in my practice constantly is look at our informed consent forms. And it's not just for fear of litigation, it's also for my, you know, to assuage my guilt, for me to recognize that I'm sharing with my patient all of the things that could potentially happen, obviously recognizing that I want none of those bad things to happen, but that they are all within the realm of possibility, so that if something horrible or unseen does occur, the patient has been previously informed. I have just a couple of other things, and I wanted to close with, you know, I shared with Dr. Shepley that I was giving this presentation. He is the president of the ADA, and he wanted to give a message to all of us. And so he just asked for a minute of your time, and I'd love to be able to let him reflect on dental guilt.
Hi, Nipa. This is George Shepley. I'm here in Portland, meeting with ADIA. They have their gala tonight, and I've been busy all day and I'm rushing to go, but I promised you a quick video on when things happen in the office that don't go the way you want. What do we do? And my advice for that is this: be kind to yourself, be honest, be authentic. Somewhere in your life, you're going to do something that doesn't work out well, and it's not a big deal to redo it. And if you feel that that's the proper thing to do, do it. There will be many times things don't work out. It's not your fault. Things happen. Be kind to yourself. Handle it the best you can. Love yourself and move on. Things are going to happen. And the more things that happen, the more we learn. So look at everything as a learning experience to do better. Don't beat yourself up. It happens to all of us. So thank you. I don't know if this will help, but I just want to thank you all. It's not an easy profession, but it's the best. So do the best you can. Thank you.
So these are some of the references, some of the articles that I've looked at. Again, for me, this has been sort of a lifelong quest. I've, at least since I've been a student, I've been wondering about the origins of why dentists feel such doom about the work that we do and the care that we provide. That's my cell phone number and my email address if anybody has any thoughts or feelings that they'd like to share. Again, I'm not an expert by any means. I'm just somebody who, you know, again, I think it's important to share this information. I think it's really important to recognize you're not alone in this, that a lot of us feel this way a lot of the time. And giving that feeling a name and identifying where you are in the process of healing from it or experiencing it is extremely empowering. And I'd love to take any questions, any thoughts or feelings anybody has, and I'd love to, yeah, have some dialogue. How do you balance increasing treatment plan acceptance, but also mitigating your guilt by describing risks for informed consent? So, Christy, help me if I'm misunderstanding the question. I guess you're asking, how do I get patients to accept treatment but not feel guilty? Is that correct? Okay, yeah. So for me, I practice based on the Pankey Institute philosophy of care, which involves what's called co-discovery. So I don't do dentistry to patients. I do dentistry with patients. I bring them along with me for the ride. I make sure that they're fully aware and extremely cognizant of what they need versus what they want. And then I really allow them to tell me how to proceed. So that's been my most comfortable way and method of practicing. And it's been the only way that I've been able to mitigate the guilt that I feel. I'm not a salesman. I'm not going to tell you what you need. I'm going to offer you options and I'm going to let you tell me where you're comfortable. Oftentimes, I borrowed this from my friend, Paul Goodman from Dental Nachos. You know, I will discuss a treatment plan with a patient that might have a pretty hefty dollar amount. And they kind of look at me cringing and I say, that's okay. That's okay. We can still be friends. You know, you don't have to accept the plan. We can do something different. I'm here for you. There's nothing wrong with it. There's no judgment based on what you can and can't or will or won't do in terms of dentistry. I'm here to help you. I'm here for you. And that's been, for me, how I've been able to mitigate guilt that I feel from presenting sometimes very large treatment plans, because that is a bulk of what I do in my practice is prosthodontic work. And then in terms of describing risk for informed consent, a lot of it's live and learn, but there are a ton of resources out there. Again, your malpractice provider has consent forms that you should really take a look at, that really spell out all of the potential risks and benefits of many, many types of treatments. Oftentimes I find if I can imagine a negative outcome for a procedure that I'm about to perform, I really want to discuss that with the patient and have them sign that they understand what I just shared with them. So I kind of make up some of my own informed consent forms that are one-offs based on what level of understanding I believe my patient has. I hope that was helpful, Christy. Kayla's question was, what do you do with a patient that does not seem to listen to the risks and whenever something does not go to plan, only places blame back on you? I think, Kayla, in that situation, it's difficult to do, but I would sit down with that patient and discuss a philosophy of care issue, and state to that patient, you know, I have done my very best to manage your expectations, and I feel as though there's a little bit of a discrepancy between our philosophies of care for your dental health. And in this situation, I feel it'd be best for you to seek care elsewhere where maybe you'd be more comfortable with the outcomes that they'd be able to provide. And so in that situation, nobody's wrong. You're just different, and that's okay. But in my practice, for example, we dismiss patients regularly. It's not an uncommon thing. If I feel like my patients a patient is getting to a place where they don't hear me or they can't hear me, I don't think that's a safe space for either of us. So that's how I generally do dismiss patients. It's with quite a bit of respect. There's never crying. It's usually very collegial, and you know, it's what's best for everybody. Any advice regarding dental burnout and preventing it from affecting future work? Absolutely. So dental burnout has a lot to do with unreconciled guilt. So in my experience, having things that don't go right, and feeling like things have failed you and people have failed you and teeth have failed you, that has a lot to do with dental burnout. Obviously, it has a lot to do with work-life balance as well, and a host of other things, but I do think dental guilt takes up a large space, you know, in that room. So for me, obviously, when it comes to dental burnout, you know, recognize it early, know what's happening, and know what you need to do to get right. So if that means taking a little bit of a mental break or taking a little bit of a physical break from dentistry, it's okay. You know, forgive yourself the space that you need to get better and to feel better. When I purchased my practice, I thought I purchased my practice 5 years ago. And I thought I would like hit the ground running, and I wanted to see everybody and meet every single patient right away and like change the world. And the best advice I ever got was from Dr. Bruce Terry, the endodontist that you guys heard from earlier. And he said, you know, it's a marathon, not a sprint. He's an extremely patient, strategic, gentle person who needed to, and I'm grateful that reminded me that I could pace myself, and that I didn't need to burn out so quickly, that it was a long career I had ahead of me. So I think it's really important to recognize that. One of the other things for me that's been important is kind of reframing the way I look at, we talk about failures in dentistry, and it's really hard to say that word. It's really hard to feel that word. It's hard to hear that word as a patient. So I don't say that anymore. So for example, if you know a patient with a bridge they've had in their mouth, I go, wow, what a service life. You know, you've had that for 12 years. It's done such a good job for you. And how exciting to know that you've outlived your dentistry. That's amazing. You know, you've outlived all of this beautiful work. That's incredible. We're like, this is fantastic. Let's talk about what we can do better. And let's talk about all the new materials that we have and the new cements and adhesive dentistry and the technology and how I'm going to take care of you this time around, because I mean, this was stunning work. And so to look at it that way and to make it positive and to make patients feel like, you know what, it did serve me. To me, that's been very invigorating and exciting in terms of future work. It doesn't make me feel like I'm fixing a failure. It makes me feel like I'm helping progress a patient. Another question, how should we safely challenge ourselves to grow clinically? Limited experience in school, might not know what our limits are. What is achievable and should be pursued to grow as a clinician versus what is out of our scope and should be referred. I think this is when you have conversations. You know, it's interesting, we live in the information age, and yet I feel like we speak with one another far less than we ever did. Like I'm looking at a bunch of blank boxes right now, which is a really hard way to give this talk, by the way. I've never given this talk virtually, always in person, because it's quite emotional when given in person. I hope it has felt some way to you. But this is when you call and this is when you talk. I mean, for me in the beginning, when I started practicing dentistry, I got on the phone a lot. Dr. Terry, again, one of the endodontists that you just heard from earlier, I called him many times. Can I do this root canal? Like, should I do this root canal? I don't know if I should. And he would walk me through the process. This is how you'll do it. This is how it'll work. This is what you'll see. This is how the patient will feel. This is when you know to stop and call me. I mean, really just taking the time to call on your support system and to say, I don't know where the limit is. I don't want to make a mistake that's really damaging for my patient, but I want to grow. So tell me where that is. Help me understand what I can do. I think that's super important. Also, if you have the opportunity to work with a partner or work in a setting where there are more than one doctor, call on those individuals and ask for their honesty and their authenticity about your clinical skill and your clinical capacity, and you'll grow that way. You can grow together. Any other questions? I really appreciate all taking the time to kind of hear me out. I hope this was helpful for you in one way or another, even if you just start to think about dental guilt as a feeling, because again, if you give it a name, then you can figure out how to conquer it. So I really appreciate all of your time this evening, and thank you all. Have a good night.
Bye, Nipa. We love you.
Amazing, Miss Nipa.